As the COVID-19 pandemic accelerated across North America in March 2020, governments in jurisdiction across Canada and the United States seemed unable to distribute the necessary personal protective equipment, PPE, to the people who needed it most. In response to this failure, many communities had to source and distribute the equipment through autonomous action. We at the People's Health Movement in North America spoke to activists in Saskatchewan and Washington State who worked on initiatives to address the gaps in PPE supply as the pandemic began to learn about what they accomplished and what still needs to be done. Meet Tyrell Weiss in Regina, Sejal Bargava in Saskatoon, and Evelyn Romano in Seattle.
Could you please describe what work you're doing?
We were a group of med students. There's 3 of us on the organizational team and about, I'd say 15 to 20 of us on the ground helping out.
We had certain students who were in charge of contacting businesses and places that we thought might have residual masks from before all this happened. So a lot of esthetician's office, dental offices. I was part of the group who would actually collect the items. So we'd wipe them down and then transport them to the house where we were storing all the items prior to us actually donating them to all the frontline workers.
I think we collected surgical masks and 95 masks and face shields, as well as gloves, as long as they were still all in their original unopened packaging. And I was kind of just coordinating the groups.
I started a fund called Pandesal Cafe Fund, which is also Bread and Coffee Fund, as an appreciation effort for custodial workers at the University of Washington. And so I was able to collect funds to buy bread and coffee supplies. I also gave out handmade cloth reusable masks that my friend and her mom made. So I was able to also distribute that to all 278 or 79 custodial and recycling operations workers.
Why did you start this work? What needs did you see in the community?
We basically saw a need to collect personal protective equipment. There was kind of a cry out by physicians to protect healthcare professionals who were on front lines dealing with COVID patients or potentially COVID patients.
So around March, I saw a lot of stories of our community coming together to show appreciation for healthcare workers, and I felt like there weren't those stories for custodial workers. And as a daughter of 2 UW custodial workers, I felt like it was really important for my mom and her coworkers to feel appreciated during this pandemic. And so I wanted to make sure that even something as small as bread and coffee would be one way to show our appreciation. The mask came about because I knew that my friend and her mom knew how to sew. And so I thought that would be a really nice way to add to coffee and bread, just as sort of protective measures, because I feel like custodial workers on campus are being overlooked since they aren't working in the hospitals, but they're still leaving their homes, and that's still a risk to their health and lives, and also the health and lives of their family members.
I just saw it as an opportunity for me to kind of help out because as medical students, we kind of see that there is a need, and we saw kind of the urgency for these kind of things.
Have you experienced any challenges doing this work?
It was hard because people wanted more than one mask, and I only had one to give out. And so that really tells me not only was it appreciated, but there was a need for masks at the University of Washington.
I think it was the actually soliciting donations part that was the biggest challenge. It required a lot of manpower. We emailed, we did phone calls, like cold calling people. And I think it just kind of was tiring to maybe hear no from people if they needed their supplies, which is valid. It wasn't easy to just send out a mass email. It was a lot of follow-up. And then I think another thing that we had to keep in mind was how we were going to do collection in a physically distanced way and keep it safe. So we were following protocol, I think, laid out by someone at Western University who launched the PPE collection program. So we followed their protocol in terms of wiping down materials, like not having any personal contact with drop off. I'm grateful that we had a framework to work off of and that we didn't have to come up with a lot of that on our own.
What more do you think needs to be done to protect people's right to health?
PPE is really important, making sure that everyone has what they need to feel safe to leave their home. And in addition, I feel like hazard pay is really important just for institutions and organizations and businesses to acknowledge the fact that essential workers are risking their lives, and stay home, stay healthy does not apply to these workers. And I think something like hazard pay really needs to be prioritized on top of PPE.
The one thing that this pandemic has personally highlighted for me is the paradox of public health. So the successes of public health mean that we don't see things that they've prevented. And it's hard when you're canvassing for funding and you're competing for a specific budget allotment towards your services when you don't have anything to show for it because you've prevented all these crises. I think as soon as you start funneling funding down into the reactionary or downstream channels, it's fruitless. It's hard to keep up. You're basically just always playing catch up with what's happening. So if we can start with, more upstream, higher level, bigger picture interventions, such as funding public health, maybe domestic production of masks and PPE. Experts are calling for it, with whether they know it or not. I think there's been a bigger focus kind of on the systemic side and the systemic perpetuation of inequities and imbalances. And so I think that we need to take a serious step back and think of why are we seeing all these downstream issues that are so amplified, and be like, well, maybe we can start by preventing them and by channeling the more upstream causes of what we're seeing on the ground, which was the PPE shortage or the, explosion of COVID cases.
One final question. Do you see yourself continuing or doing this kind of work in the future?
If there's ever a pandemic or something like this again, I can definitely see myself getting into this sort of work again.
I did my undergrad in kinesiology, where I think is where I came to appreciate preventative medicine. And I love organizing things. I love getting people together to work towards a common good. It's something that keeps me going within medicine and something I'm really passionate about.
Advocacy work is really important to me. So I think it depends on what the needs are in our community. And I was seeing that right now and in the past few months, the needs have been around PPE. And so that's sort of where my advocacy efforts have been going to. I see myself doing advocacy work, and for now it will be around PPE until the next advocacy issue comes up.
Great, thank you.
These activists highlight the work that communities have to do when the systems that are supposed to protect us are shown not to do so. People's Health Movement North America celebrates the work of communities who are protecting themselves from the pandemic while we continue to push governments to fulfill their responsibilities to keep us all safe. Join us